It is, as described in today's report, an exceptionally toxic debate about how children questioning their gender should be treated. Political posturing and polarisation, but still people at the centre of it all. One of them, Jack, which isn't his real name, who started seeking gender identity treatment a decade ago. He's now on an adult waiting list for hormone treatment, but wants today's review to change things in the future.
I wish that it had been more open and that it had been more of a safe space where I felt like I could have spoken and been honest with people, and that not felt like I had to prove myself. There are children that have been let down by the service in multiple different ways. What I hope is that with this new service, with the recommendations that Cass is making, that a service can be created that lets less people down.
Dr Cass's review said children have been let down by remarkably weak evidence on medical interventions, recommending an extremely cautious approach in the future if hormone treatments used to delay the onset of puberty are given before the age of 18. She suggests holistic care needs to be taken when assessing children, and that mental health or neurodevelopmental considerations are made, and says it's possible that a child's social transition, where they use a different name or pronoun, can change the trajectory of their development. It's that language that some in the trans community are worried about.
We have a number of concerns. So some of those are about the way that things are framed very ambiguously and the fact that they are very open to misinterpretation, particularly around areas such as social transition, access to gender-affirming hormones and puberty blockers. So there are a number of areas where that the implementation will be key.
Have you felt that has made a difference?
What has made a difference is the political argument. The report made clear other healthcare services are not discussed or debated like gender treatments. The Prime Minister, though, on a trip today to talk about crime, welcomed the review's recommendations.
It's very much in alignment with our way of thinking, which is to exercise extreme caution on these issues because we simply do not know the long-term consequences and impacts.
The NHS say they've made progress in shutting down the Tavistock Centre, the once centralised clinic for child gender treatment, as new regional clinics open up. And they have new policies too on stopping the routine prescription of puberty blockers. But still, the conversation and the criticism will be loud, online and offline. Legal disputes, protest and rows about rights. Molly Malone, Sky News.